Same.
Your gums is foundation of your teeth and
Mhm.
your implants and your other restoration. Your gums have to be healthy and it's systemic. We humans are closed system, so but we have a basing laser in office. It's called photona. It heals the gum and produces the growth factors that help you to heal faster.
Let me ask you, like, what, which branch of like what people need to fix, like, periodontal disease and chipped teeth and crooked teeth and whatever it may be, would you kind of agree or disagree that periodontal disease, having a gum disease, even though it's a light one, which is an infection in the mouth, is one of the most hideous disease, and most dentists keep saying to the patient, look, you will eventually, 1 year, 6 year, whatever, lose your teeth, or they will get crooked and you will look ugly. Either way, not good. And then it will cost much more to replace them. And while this is all true, all of us think that in 6 years, um, we make more money. So what? We pay a little money, blah, blah, blah. After all, we're not anymore in time of George Washington, which apparently had a wooden tooth. Don't know whether it's true. You guys make so good implants these days that frankly, who cares whether it's my tooth or an implant to a certain degree? But my point is it true that this infection in the mouth is so devastating to the body, to the general other health, mostly not detected because because of it might have diabetes. A pregnant woman might have problem. The immune system goes down like insane, which makes a flu and anything just be more hard. Is that true that people should be paying a tremendous amount of more attention to the perio and should, for a change, do what the doctor says, doctor's orders?
I 100% agree with you on that. Um, I can compare periodontal disease to cancer. The problem with both that you don't feel pain, you don't feel discomfort, and it's quiet. There is not really symptoms unless you come to a dentist or when it's too late, when your teeth start being very loose or extrude or they start becoming longer or very loose. And
Well,
when it comes to a
you have
dentist,
a little bit of bleeding as a symptom, probably.
bleeding, gum bleeding, it's all signs of inflammation. However, a lot of people don't pay attention or they don't want to pay attention. They start paying attention when it's too late. Um, that's why periodontal disease is very sneaky, I would say.
Yeah. My point
It's
is,
a big
people are not, sorry to interrupt you, but people are not only not paying attention, people ignoring the doctor saying, let's do surgery, kind of like, well, wait a minute, okay. It's a little bit like being 2 pounds overweight or 5 pounds for that much or 10 pounds and like, yeah, it's all right. But pretty soon it's going to be 40 pounds and 40 pounds is a problem. Maybe 5 or 10, not so much. Is it the
I would
same?
say your gums is foundation of your house, of your building, which is your teeth and your implants and your other restoration. So if your foundation is not good, so the whole building will collapse. So your foundation is your gums. Your gums have to be healthy and it's systemic. We humans are closed system. So bacteria from gums, from not treated gums or from infection travels around the blood circulation. It goes to the heart. It goes to pregnant females. It goes to the fetus. Unfortunately, a lot of patients we have knee replacement, hip replacements, which are pretty successful. But unfortunately, periodontal disease may fail those big implants, hip replacements, and knee replacements. That's how
You got a good point.
dangerous it is.
You got a good point because from what I know, most surgeons on any type of slightly more difficult, longer type of operation, they will demand a bill, a good bill of,
A dental clearance from a dentist that the
yeah,
patient is free from mouth infection, basically.
infection.
Gum
So
is
it's not that surgeon wants to you have beautiful teeth, white teeth
Yeah.
and stuff. He
They
just
want
wants no
healthy
infections
teeth and gum.
in it. So if it why? Because the operation itself could be sabotaged and could, because of it, not succeed and create a literally deadly
Yeah,
problem.
by periodontal bacteria, by persisting
Mm,
bacteria in the mouth. And
yeah.
thank God to technology, today we don't have to do gum surgeries anymore. We have amazing laser in office. It's called Photona. It has amazing capability. Not only we have to we don't cut the gum anymore, and there is no healing process after that. It skips those steps. Basically, it sterilizes this bacteria in the mouth. It heals the gum, and it produces the growth factors that help you to heal faster. And it has capability unheard of before to regenerate the bone back
Wow. Oh,
around your
incredible.
teeth that lost bone. That's amazing capability of the laser. That's why it's a new technology. It's amazing technology because I used to practice gum surgeries with scalpel. Now there is, thank God, no scalpel and there is no healing for the patient. The most important part is no healing part. You can get up from dental chair and go to a restaurant, go to job to your wife, go meet your friend. There is no downtime. There is no discomfort. There is no pain after that. There
In
is
one in one short word, you did not have an operation because you didn't have one.
it's very conservative now. There is no surgery anymore. Thank God.